I'll give you actually a fairly short, kind of, I want to say a little bit of a summary of what some of the speakers have given already, and maybe introduce the next speaker during my talk as well. We've seen a lot of iterations of this already, and we will see it very soon. Yep, there we go. Essentially the combination of art and science, or art and technology. But I'm going to focus a little bit on fetal medicine. This, I think, will also serve as a great introduction for Dr. Sokos, who will speak after me. No conflict of interest. You already heard about the history of medical illustration. Of course, we owe a lot to not only Mike's Bradle, but his, well, I guess now one of his successors, Ian Sook, and so a lot of it you'll see some repetition in here. But medical illustration is a time-honored trade that's been used, as you saw, for centuries. It explains complex concepts, as Dr. Goslin said, and procedures in ways that words or even a photograph can't, because you see on the left-hand side, not a very good photograph of an operation. I think the photograph mostly proves that the surgeon was there, and that's about it. The middle one is a fantastic rendering by Max Bradle himself, and I would argue that the one on the right is even better if you want to explain how to do a procedure. The problem is that the fetus is kind of hidden. You really can't get to the fetus very well, and so throughout the ages, the fetus was pretty much, again, not visible, and artists had to extrapolate from, for example, babies at birth. And here you see some 16th century images of what a fetus does not look like in utero at all. In fact, I'm not sure why the one on the right seems to be skateboarding down the uterus, but that's what he does. You also heard about Galen, who was, of course, a very important figure, and the problem is that he was, I guess, called out by my next person, but essentially most of what he taught was based on animal dissections, because human dissections were not commonplace. It's a long story why they weren't, and it wasn't really that they were illegal necessarily, but certainly they weren't available. And you see a similar but not quite as good picture as Dr. Sook showed of Galen, in a picture from a book describing his dissections of a pig in this case. It was really Vesalius who pointed out that even though Galen was a very important figure, he made a lot of mistakes, and some of the mistakes were because he was doing animal dissections. And here's a kind of a quip, or at least a barb directed at Galen, saying that you see on the upper hand here. Sorry about that. This is a uterus as described by Galen, which is really bicornuate uterus of a non-pregnant dog, as opposed to the human uterus that is not quite as bicornuate. But so after that, around the time of Vesalius, after that, a lot of the knowledge that we had about fetuses was from autopsies, and you've seen Da Vinci mentioned before by Professor Sook. This is in the 16th century. In the 17th century, Bidlo and de Leresse in the Netherlands had quite a few descriptions, illustrations of a fetus, but again based clearly on autopsy of the fetus. 18th century, William Hunter had pretty much made a lot of money doing human dissections of freshly diseased pregnant women, unfortunately, and you have this. And even to this day, when we represent a fetus, very often it is a newborn, and we slap an umbilical cord on it. And I know this for a fact because Aimee, Camilleri, who did a fantastic job, told me that she modeled this fetus after her newborn nephew. Also, just want to point out that this fetus is circumcised, so clearly a little too, some things are not quite correct. So we still have that because we just don't have access to a live fetus in utero. On the other hand, and you've seen a couple of great examples of that, mostly from Dr. Wu, is that now we have fantastic ultrasounds and MRIs, post-acquisition volume rendering. You can go from this to this here. This is just a 3D ultrasound. You see, I'll show you a little more about this one as well. So you really have lifelike representations of the fetus, which, as you saw earlier today, you can also make into 3D printed models. And here are the two artists, and especially the one on the forefront, Scott Collins, is the wizard who does all that. This looks a lot like what Dr. Wu showed you and what Joe Crozier made with the printer, but this is all virtual. And this is based, in fact, on the very same MRI of a near-term fetus in a mom who had been in a mild car accident, and fortunately everybody's fine. But this gave an incredible opportunity to have imaging of a near full-term baby, a fetus. So it's highly sophisticated. The problem is that there still are some issues. It's here and it should be rotating, but it's not. There's still some idiosyncrasies because there are some like warts because it's, acquisition wasn't perfect. Clearly it's a baby, it's a fetus, but there's something wrong. This is another one that we had of a lymphatic malformation, but clearly there's problems with, artifacts, imperfect image capture, and idiosyncrasies of each particular patient. So what we're trying to do here is marry art and science, which is kind of the topic or the theme of this conference anyway, and try to get the best of both worlds and essentially have an approach that's bigger than the sum of its parts. So we start with the 2D imaging that you saw. We get the volume and surface rendering that Scott Collins does so well, and we use that model to explore all possible points of view so that we can choose the ideal view to illustrate, and then we start building the illustration. And of course, it depends on who the illustration is meant for, and I'll show you examples of that as well. So here's an example of a fetus with a spina bifida, myelomeningocele. You see the arrow here, little bubble of fluid right there, and you can then transform this using mostly, in this case, GE software, but other software as well, and you can create this shape which looks like a 3D fetus inside the uterus. And then you continue to manipulate that using thin slice interposition, or interpolation rather, where you essentially refine this. You could still see the little myelocele here. You take away all the other structures except the amniotic fluid, and now it really looks like a live fetus in a normal position, and you see here the myelomeningocele. And this is pretty remarkable, but you can do better than, we can do better than that. You can also rotate it in 3 axes to try to get the best view so that you can represent what you're trying to show exactly. And so you go from this to that to what Dr. Wu already presented. You can have a representation that looks lifelike and mild in a way, because this is great to show the parents of a future, of a baby with a spina bifida, what it's going to look like. I want to shout out to Jimmy Jha, who was an undergrad student, non-medical at Brown, who was one of the early participants in our medical illustration class, and he's an incredible artist, and he's now a medical student at NYU, so we may see him back as a physician. You can also do this in line drawings where you essentially point out specific things, for example, residents or medical students. So it depends on who the audience will be. I'm going to show you a very quick example, a few very quick examples of what I mean. This is not anything to do with the brain, but this is a little lung lesion right here, what's called a sequestration. Using exactly the same technique, you can rotate it, you can enlarge it, you can cut away things. This is the placenta in red over there, and there in purple is the lesion. It's incredible that we have those images, but they're not completely perfect. We then choose the right angle. We even rotate them to get a better view. And this is another student of ours, Matt Rios, who's now a RISD student, and after next year may in fact go to medical school now. And the idea is that in those lesions you want to show that there is a feeding artery and a draining vein right there. Again, we know they're there, but it's really hard to tell. And then you create the image, and these are his drafts, and this is the final product where you have an unusual view of a fetus. We usually look at it from the side or the front, but it clearly illustrating the 2 vessels, and you see that this looks exactly like the fetus in utero because it was captured by the MRI. Here is an interesting, so when I presented this last year at a conference, somebody came up to me afterwards and saying, well, we have this case. We have conjoined twins. We have an MRI at 16 weeks, and you think you can do something like that to show the parents and help us figure it out. These are the MRI pictures. Not a great pictures. I mean, you can see hands, see an abdomen, you see a head over here, but this is not fantastic. Very early, 16 weeks. You can see kind of body here, body there, and the arrows point to the joint area in the sacrum, probably. Scott Collins was able to reproduce this model, which is great, the dancing babies, and it's incredibly remarkable for 16-week babies, but it's not perfect, as you can see. So we looked at the perfect orientation. This one was the best angle, and then essentially we knew that this was a true connection, but here this is not a true connection because those are the artifacts of the MRI. And so this is what Matt Rios, the same medical student, RISD student, did, showing where they're fused in the back, but clear for the rest. And this was incredibly helpful for the family, for the parents, knowing what they were going to get themselves into. The question for us was, though, or for the physicians was, well, where are they fused and what does it mean for separation and for function afterwards? And going back to this image, this is the best that Scott Collins could do. This is a great work of art, I think, but it's absolutely not helpful, other than that you can see the CSF in blue, and you see this thing that doesn't look like a spine at all. So it's hard to tell what's going on, and that's where medical illustration can help a lot, and this is what we came up with. And in blue, again, is the CSF. They were based on where the cord should end, and it was a fused sacrum, but the rest was fine, and this apparently was spot on, and both babies have perfect functions and are being separated within the next couple of weeks. So this was very helpful for the physicians, for the team. Lastly, very quickly, of course, the conjoined twins don't happen very often. About 2 months after we finished those illustrations for somebody else in Minnesota, we had conjoined twins of our own. Again, at 16 weeks, they joined in front, just below the umbilicus. These are very crude MRIs, but Scott Collins was able to give us this here. And again, you recognize 2 babies, 2 fetuses, but it doesn't give you a lot of information, pretty crude. And again, by illustrating this is again Matrios giving us a view of what they're fused like, and this is great for the mother, but for us, we were more interested in knowing where there's some joined bowel. There probably is exstrophy of the bladder that is joined, but everything else seems to be okay, so this is more helpful for us. So in conclusion, medical illustration plays an important role in disseminating medical information. Post-acquisition manipulation of cross-sectional diagnostic imaging is absolutely impressive, except that it is a little flawed. And so combining both the technology and the art optimizes didactic value of an illustration with maximal anatomic accuracy. And because it's inherently hidden from view, I think the fetus particularly benefits from this novel approach. That's it. Thank you.